Okay. So the first consideration, pag yung ilong ng isang tao ay maputla, you would immediately think of stomach and spleen-Yang deficiency with empty cold, maputla eh. So there will also be discomfort or dull pain in the epigastrium that is better after eating. So pagkakain niya nawawala, no? And better pag nag-apply ka ng pressure or massage. No appetite, preference for warm drinks and foods, vomiting of clear fluid, no thirst, cold and weaklings, tiredness, pale complexion, loose stools, feeling cold, cold limbs. So when you look at the tongue, it's pale, obviously, and wet. And then the pulse is deep, weak, and slow. Another consideration would be among women, okay? Yung mga mapuputla ang ilong. Pale bridge of the nose, okay? Tinan-tinan yung mga ilong nyo. Dull pale ang face. Dizziness, blurred vision, floaters, numbness or tingling of the limbs, scanty menses. So the tongue is pale, pulse is choppy or fine. And the third one, pag may nakita kayong pale ang nose and swollen ang tip, okay, hindi lang siya pale, kundi swollen. Swollen face, greasy skin. So kung nakikita niyo yung icon dyan, nakikita niyo medyo maedad na, no? Yun. Abdominal fullness and distension, nausea, vomiting, or watery fluids. Dry mouth without desire to drink. Shortness of breath. Dizziness, feeling of oppression of the chest, swelling of the limbs, expectoration of thin watery sputum, inability to lie down, kasi pag nakahiga siya lalong para siyang nalulunod, parang masyadong mabigat. Swollen tongue, sticky coating. So this is very, very characteristic. So when you look at when you feel the pulse, it's deep, wiry, or deep, slippery. Now let's go to yellow nose. First thing that you will have to consider is damp heat in the spleen. So bright yellow nose, if heat predominates, pero pag yung nose niya is dull and yellow, dampness predominates. Okay, so my difference po, bright yellow, dull yellow. Greasy skin, fullness of the epigastrium, epigastric of abdominal pain, sticky taste. Thirst, no desire to drink, poor appetite, feeling of heaviness, thirst, nausea, vomiting, loose stools with offensive odor. Remember, pag may amoy po yung ating stools, that's very damp heat, no? Feeling of heat, scanty dark urine, headache with feeling of heaviness of the head, dull yellow complexion, bitter taste, red tongue with sticky yellow coating, slippery rapid pulse. Another consideration would be chronic Spleen-Qi deficiency with retention of dampness. So dull yellow po ito. So this is very deficiency. Dull pale face, poor appetite, slight abdominal distension after eating, tiredness, lassitude, pale or sallow complexion, weakness of the limbs, loose stool, slight depression, tendency to obesity, abdominal fullness, feeling of heaviness, sticky taste, poor digestion. Then you have undigested food in the stools, nausea, dull frontal headache, excessive vaginal discharge, and the tongue is pale with sticky coating, the pulse is soggy. Third consideration for yellow nose, liver blood stasis. Okay, so when you look at the bridge of the nose, it's dull and dark yellow. Dark complexion, remember, stasis po ito, blood stasis. So medyo iba na, medyo biglang nag-iba yung complexion, medyo dumilim, no? That's very blood stasis. Kaya tingnan niyo yung mga friends niyo sa FB. Alam niyo kung sino yung may blood stasis. Hypochondrial pain, abdominal pain, painful periods, menstrual. Okay, so sa mga babae naman, you would always ask, anong kulay ng blood, ng menstrual blood mo? Is it clotted? Is it dark blood? Dark red. Masses in the abdomen, purple nails and lips. So titingnan mo yung lips, no? Baka hindi talaga, although uso na ngayon yung mga lipstick na purple, pero hindi naman pala lipstick yon. And tingnan nyo yung tongue, purple na purple. The pulse is wiry or firm. The fourth consideration for a yellow nose is spleen heat. So this time, pag heat, hindi siya dull. bright yellow, and then dry. Burning, epigastric and abdominal pain, excessive hunger, red tip of the nose, dry lips. Actually, the tip of the nose is very, no, it actually tells a lot about the spleen, no? Dry lips. So, tingnan niyo yung dulo ng ilong nyo, no? Okay. Dry lips, mouth ulcers, stirs, dry stools, feeling of heat, scanty dark urine, yellow complexion. The tongue is obviously red with dry yellow coating, and the pulse is overflowing and rapid. And the last one, may edad na naman yung nakikita niyong icon, no? Dull yellow, so dull. Ibig sabihin, yung phlegm niya dahil po sa deficiency. Dull yellow, it's a deficiency condition. Swollen, hindi lang siya dull yellow, swollen pa. So biglang nagnamaga yung ilong. Abdominal fullness and distension, nausea, vomiting, watery fluids, dry mouth without desire to drink, shortness of breath, dizziness, feeling of oppression of the chest, swelling of the limbs, and then nag-expectorate po siya ng thin watery sputum. Inability to lie down again, swollen tongue with sticky coating, the pulse is deep wiry or deep slippery.